Baccalaureate perspective of communication and closing the gap in care for the diabetes mellitus type 2 Hispanic population in Northern California by Colleen Basaldu, Perla Corral Lopez, Camila Holmes, and Tasia Sherwood. There are 9 concepts adapted from work of Loretas Durad that describe the BSN curriculum. Today we would like to elaborate on a concept of communication. Communication as a course objective is understood as exploration of how written, verbal, nonverbal, and emerging technology methods, like smartphone applications and social media, can influence health outcomes. In other words, how communication can affect the results of care we as nurses provide to the population as part of our everyday practice. In a modern world, information has become a ubiquitous resource, available at our fingertips. Just take a look at how getting the crucial information we need has evolved. It used to be that specialized knowledge is only passed on at schools, universities, through lectures given by professors. That still is the truth, but besides that, we get to find the same quality information on internet websites and YouTube tutorials and webinars, essentially anywhere, as long as we have the desire to look for it. The skill has now become to narrow down this endless stream of information to the crucial pieces we need to be effective and to make an impact, specifically here, as we are trying to refer to communication and nursing aimed at attaining an optimal health outcome in a population based practice. We have to understand that the skill to pick and choose the information of value and to narrow down the confusing informational influx still belongs to us, trained professionals in the field. We are often the vessels that are able to filter through the communication jungle and validate whether the info on an illness right off of a website by our patient is in fact something they should go by, or rather discard as it might as well harm them in the process. Our communication, clear, succinct yet thorough, adjusted to the level of our patient's comprehension, is what can make a massive difference in their health outcomes. Nurses see hundreds and thousands of patients a year. As we enter the professional field of nursing, we bring new desires to teach and change the health trends for the better. Together, we have the potential to close the gaps in care that result from poor or interrupted or ineffective communication. As mentioned previously, communication is a key component in initiating, progressing, and maintaining healthcare throughout the world. There are many communities and populations that tend not to have access to simple means of communication and can inhibit the quality of treatments required. One of these populations that has a lower than optimal health outcome is the diabetic population. More specifically, the Hispanic population has a lower than optimal health outcome with treatment and management of the diabetes mellitus type 2. The diagnosis and management of diabetes mellitus type 2 requires direct communication with the patient and healthcare providers. Patients depend on healthcare for maintenance and ongoing educational tools that aid in managing this chronic illness. There are certain health disparity gap factors that affect specifically the Hispanic population. Knowledge discrepancy. It's relating to the factors that influence the achievement of glucose control and self-management practices in a Hispanic population, coinciding with health literacy. Language barriers. Reciprocal communications is vital when it comes to providing or receiving healthcare. Language barriers inhibit the understanding and comprehension of what diabetes mellitus is and how to manage this lifelong illness. The physician may not speak the same language. Therefore, utilizing interpreter services or family members to translate the pertinent information may not allow patients to openly discuss their concerns about treatment or leave gaps in full understanding. Financial challenges. Income plays a part in accessing care to health services, including transportation, taking time off for doctor appointments, and overall cost of services. Cultural and demographics. Considerations which all play a role in lifestyle changes and controlling diabetes. Healthcare providers urge to understand the Hispanic culture and forms of respectful communication with the patients. Closing the gap. Baccalaureate perspective. In a survey done in 2011 through 2012 by the California Health Adult Survey, the prevalence of type 2 diabetes among Hispanics was 10.5% in California. This group had the highest prevalence compared to other ethnicities and races. Closing the communication gap requires the nurse to understand the cultural beliefs and principles that are valuable. Simpatía, personalismo, respeto, familismo, and fatalismo. In other terms, kindness, formal friendliness, respect, family, loyalty, and faith are important in a Hispanic culture and customs. Obtaining and analyzing client food patterns is important to investigate because many seek remedies that are maybe unsafe. They may have a diet that is high in fat and sugar, which poses an increased risk for other illnesses. In order to facilitate gap closure, the nurse must find a way to overcome the language and communication barrier to foster the self-management of diabetes. If the healthcare provider does not speak the same language as the client, an interpreter should be obtained or use a family member as a last resort. Voice-activated applications can translate phrases from English into Spanish and vice versa. Written materials, such as brochures and pamphlets, should also be provided in Spanish. Cusi and Ocampo in 2011 found that delivering culturally sensitive programs may improve the outcome in the type 2 diabetes Hispanic Latino population. Several ways can be used. For example, offering bilingual activities, formal type 2 diabetes and self-management classes, and short 2-hour classes over 10 weeks. The American Hospital Association provides practice guidelines to address the health disparity among the Latino population. Nurses can implement culturally sensitive communication to do the following: understand the population that is served. To effectively understand what a patient is communicating, it is important to be aware of the patient's culture and what may influence his or her beliefs about type 2 diabetes and treatment. To help the patient understand the nurse can communicate health messages through the use of cultural metaphors or stories. Collect valid and reliable data from the patient, who should self-identify race and ethnicity, as well as deaf and hard of hearing information. This helps the nurse in performing a targeted cultural assessment, which is necessary to determine any tools or learning modalities needed for communication. If there is a language barrier, work with an interpreter to communicate the assessment. We provided a list of articles that you could research on your own if you would like to expand your knowledge on the topic, as well as a list of references that we used to create this presentation.